Morning, doctor.
Good morning. You may take a seat. So let me introduce myself. My name is Michelle and I'll be your vet today. So what brings you guys up here?
So my dog Bella has been coughing recently, so I wanted to get her checked.
How old is Bella?
Bella's around 4 years old.
How long has the cough lasted?
The cough lasted from 2 to 3 days, I think.
Could you describe how her coughs are? Is it wet or is it dry?
It's dry coughs, and it sounds like she's clearing her throat.
Oh, I see. So did her cough happen during when she was like possibly excited, or her leash could have been pulled, or maybe she was drinking?
After drinking water or when she gets excited, she coughs a little.
I see. Did you perhaps observe any nasal discharge or signs of fever, any loss of appetite, or even perhaps loss of excitement?
Well, none of that. She still eats normally and plays normally, just less active than usual, but it's nothing too extreme.
Had she recently been interacting with other dogs? Perhaps she went to the groomer or to the park, or maybe she's staying somewhere else?
She went to the groomers last week, but I don't know if that affects it because it's the usual groomer she goes to.
I see. When she coughs, do you see any signs of gagging or vomiting perhaps?
She doesn't vomit, but she did gag once, but mostly it's just dry coughs.
Okay, I see. Were there any past histories for coughing or any respiratory disease for Bella?
This is the first time this has happened to her, so that's why I want to get her checked.
Okay, so perhaps we can start with a physical examination to see her overall condition first.
We begin by measuring the rectal temperature to assess the animal's core body temperature. Next, we evaluate the capillary refill time on the gums to assess the peripheral perfusion. Continuing the examination, we go and check its eyes for clarity, symmetry, and any signs of abnormal discharge. After that, we palpate the mandibular and cervical limb nodes to check for any enlargement or abnormalities. Following the head examination, we assess the heart rate by auscultating over the thoracic area and then measure the respiratory rate by observing this thoracic movements. We proceed to palpate the femoral artery to evaluate the pulse and estimate the peripheral blood pressure. Finally, we observe the dog's gait and overall posture to identify any abnormalities in movements or sign of discomfort.
Okay, so after the checkup, it seems as though there are two main diagnoses for Bella. So she could possibly be having a mild respiratory irritation or infection, or it could be a mild acute bronchitis. So what we can do is we could provide an X-ray or a blood test, a PCR, to swab the inside of his mouth and see what is the actual problem with Bella. But overall, she's not having a drastic condition in which she needs medical care immediately. So she is perfectly okay, and she just has to rest, avoid barking, avoid stress, keep hydrated, and avoid perhaps dust.
Okay, I see. Will it get worse even?
No, it's definitely normal because she has no problem with her appetite, she walks properly, everything seems perfect, so it's just a mild irritation possibly.